Thank you all for coming today. We're very excited to do part two of our Understanding the Diagnosis of ADHD, talking with Dr. Gregory Harms. I'm Keith Boswell. I'm the VP of Marketing here at ADHD Online. I'll be the moderator today. We're going to have Dr. Harms present on alternative options to medication for ADHD. This is a question we get a lot. And so Dr. Harms has put together an overview of some of the things that he often talks to his patients about, talks to patients at ADHD Online about, and then we'll have time, probably about half the time, to answer any questions that you have in the audience. So please, if you do have any questions along the way, you can ask them in the chat or in the Q&A down at the bottom. With that, I'm going to turn it over to Dr. Harms, and I will pull up your presentation.
Great. Thank you, Keith. I am very excited to do this part two after last week. So we're going to focus on, you got the diagnosis of ADHD. It hopefully answered a lot of questions, but then it can also raise just as many questions, which can usually boil down to what now? And so that's what I'm going to be talking about for a little bit here, and then I'll be happy to answer anyone's questions really about kind of anything ADHD related. So if we can go on to our first slide. So I did just kind of want to briefly mention the option of medication because it is out there. It's a thing. It's what a lot of people hear about. So I figured we'd at least kind of acknowledge this. I am not a prescriber. I am not an expert in medications as treatment. What I do know, just being in the field, working with patients, is that a lot of the medications for ADHD can indeed be very helpful. So they're effective, generally safe, as long as they're prescribed by someone that knows what they're doing. They generally are considered to be a first-line intervention. For ADHD, there's a number of options out there, as well as there's medications available for some of those co-occurring conditions that I had talked about last week. So if it turns out that someone with ADHD really does have a co-occurring bipolar disorder or anxiety or obsessive compulsive disorder that really is a separate condition that they're experiencing in addition to the ADHD, there's medications that can be helpful for that as well. And so talking with a psychiatrist or a prescriber might be a helpful first step, at least just to get the information, even if you're on the fence about if you want to start with medication right off the bat. You can at least get the information, think about it, and then try some of the things that I'll be spending a lot more time talking about as well. So the medications are handled by medical professionals, which are usually physicians or other people that are licensed to prescribe, which is usually psychiatrists, psychiatric nurse practitioners, general practitioners, like internal medical doctors, like your primary care doctor, theoretically can prescribe them. I just know from experience working with a lot of GPs in various settings that they're a little bit more reluctant to because they don't necessarily have the specialized training that psychiatrists or psychiatric NPs have. But in some areas, if there aren't a lot of medical professionals around in more rural areas, they may be more willing to do that. And again, it's at least a good place to start talking, and then they may be able to refer you to a psychiatrist or nurse practitioner that they really trust to have that conversation as well. And then in some states, psychologists can get prescribing privileges to prescribe some psychotropic medications. That still is very limited. Illinois actually is one of the states where psychiatrists or psychologists, if they do a lot more training, can prescribe medications. However, they also are limited to only prescribing to adults within a certain age range, which I think is like 17 to 64. And they are specifically prohibited from prescribing stimulants or benzodiazepines, which would not be relevant to ADHD. But without being able to prescribe stimulants, that does kind of limit the treatment that prescribing psychologists could provide for ADHD, although there are some other good non-stimulant medications out there as well. So kind of the last thing I'll say about medications is there are a lot of factors that should be taken into consideration when considering starting medication. And so it really is best to have that discussion with your medical professional that will be handling that prescribing. But like I said, I think it's worth at least having that conversation seeing if that is something you want to explore or not. And that way you at least have the information and you can make an informed decision about what you want to do from that point. And I think it's that information really is critical. So with that, we can move on from medication and get the next slide, please. So medication is not a silver bullet. There are lots of other things that can be incorporated into treatment and management of ADHD. A lot of them can be good alternatives to medication if you decide that that's not something for you that you want to do. And you can really put together a good toolbox of skills and strategies to use to really improve the quality of life that you have once you know that it is ADHD that's responsible for a lot of the challenges with attention, organization, staying focused, all the things that come with that. And the reason a lot of this kind of beyond medication is helpful is because even though you're taking medication, if that is something you choose to do, you are still you. The medication does not fundamentally alter your personality. You still have all the strengths that you had, and you still have some of those growth areas or challenges that you had as well. And the interesting thing is, when we've identified ADHD, especially if you are going to take medication, reduce some of those symptoms, a lot of the previous strategies that you were using to try to manage the symptoms might actually suddenly start making things worse. Because if you're taking medication and the attention and the hyperactivity is getting better, you may not necessarily need post-it notes everywhere. And those may end up then becoming more of a distraction than being helpful reminders. Or you may not need people to remind you of things quite as much anymore. And so then you might find you're getting a little bit more annoyed with them or kind of getting reminded of the past when you're trying to move forward. So we really want to use the opportunity to work with people, work with yourself, to really try to develop new strategies, build new habits that are going to be kind of longer lasting and more appropriate for kind of this new phase of your life. And on top of that, some of the co-occurring conditions, again, if the anxiety, the depression or whatever really is truly a separate condition, that might still be having an impact on you as well. So some additional treatment strategies can also help to address those issues as well. So then if we can go to the next slide. All right, so there's a number of kind of categories that these treatments or strategies can fall into. And there's a lot of overlap between some of these two. So I'm probably going to be referring back to some things as we go through this list, but basically they can be broken down into these categories of just kind of like coaching, and then therapy, biofeedback, which I'll explain a little bit more about that when we get there. There's a lot of apps or other kind of games, things you can do on your phone, skill building types of things, using electronics, just kind of relaxation, meditation, and things like that. Working on other health conditions that might also be impacting attention and just kind of taking care of your health overall, really trying to working to improve sleep if that's a problem, and paying attention to some of the substances that you are using as well. And so kind of paying attention to a lot of these different things really can help get some of the attention problems and some of that hyperactivity or self-regulation problems more under control, either without the use of medication or kind of making the medication that much more effective if that's the route you're going. So if we can get to the next slide, I'll talk a little bit more about the coaching. And again, these are a lot of things that you can do on your own, but starting with a coach or sometimes a therapist will know a lot of these strategies as well. And that's where you can get some of that combination of therapy and coaching together. But if you're taking a coaching approach, I kind of refer to that as non-clinical therapy because you're still working with someone, but you're really working on building concrete skills. So you're not necessarily talking about your childhood or past traumas or kind of what your inner life is like. You're really working on how to kind of manage the life around you to get through work, be able to get things done at home, kind of work better with your spouse and things like that. So it's much more just kind of practical. So it usually involves things like kind of learning how to be an effective scheduler, to kind of really recognize and estimate how long something really is going to take, and being sure you block out enough time on your schedule, and really kind of getting on top of as soon as like you find out about an appointment or a meeting that you have or something that needs to do, or you decide, at 5 o'clock today, I'm going to wash the car, pulling out your phone and put it into the calendar right away. Or, if you're like me and a little bit old school, pull out your daily planner, write it in there. And then it really is about learning to just do that right away instead of thinking, yeah, I'll remember 20 minutes from now when I'm back in my car or kind of by myself, and then I'll pull it out and write it down. And of course, we know it's probably forgotten by that point. So it's learning kind of how to build that structure in, to keep a schedule, refer to the schedule. Similarly, kind of creating checklists, like a to-do list for the day, maybe a kind of a broader one for like, over the week, I want to get these things done. And so you can kind of check things off. And again, learning to add things to it as soon as you think about it. And then you can kind of do some practice activities in the sessions to really focus on learning how to just do one thing at a time. Multitasking is a myth. Like even people without ADHD, if they say that they're good at multitasking, they're not quite telling the truth, or they are fooling themselves. But with ADHD especially, we really want to focus on, let's just focus on what we're doing right now, get it done, then move on to the next thing. And building some transition time between tasks. You want to give yourself 5 to 10 minutes when going from one task to the next, just so you can kind of let the previous thing go, pull your focus back, kind of get yourself organized for this next task that you're doing, and then move on to that. And then they can help with kind of setting some goals, again, kind of what I want to get done today, as well as, kind of broader goals. Now that the ADHD is getting under control, maybe I can think about going for a promotion at work because I got some more confidence that I can do it. So what do I need to do to update my CV? Who do I need to talk to? When do I need to talk to them? Or could I carve out 20 minutes, during lunch or immediately after work to scroll through Indeed or Career Builder or LinkedIn, and see what other jobs might be out there and work on getting ready to take this next step. And so you can kind of set some bigger things like that. They may be helpful with also kind of knowing other resources in the community. So I know some of them might help if they know tips for like getting insurance pre-approvals, either for medication or like a prior authorization for that, or if you want some more testing done, if you need to get some specific accommodations, usually you do have to have a bit of like psych testing to prove that there's an impairment, even with the diagnosis of ADHD already being made. And so they may know more people in the community that they can help refer you to that. And then really kind of the important part is just having that accountability partner. So they'll kind of teach you the skills, help you practice the skills. You go out and do them for a week or a couple of weeks and then come back and check in on how that went. And so a lot of times just knowing you're going to have to tell someone, yes, I did this, will help to ensure that you keep doing that so you can build that new habit. Because we know it takes time to build habits. And so having the accountability partner can make sure you stick with these things until they really are truly ingrained as new habits. And it's something then to troubleshoot with. If you give it your best shot and it's not working, you can come back and say, hey, I really did try this. I gave it my best. I kept running into roadblocks. I didn't get the results I wanted. And then you've got someone that you can kind of talk through that with and figure out what adjustments might you want to make. What can you try a little bit differently next time? And keep going at it. They can keep you encouraged, keep you motivated while you go through this trial and error to find what's going to work for you. So that's the coaching approach. And then if we can get the next slide. And then there's therapy. And a lot of therapists, may be good at incorporating some of the coaching approaches. So especially if you want just one person to work with, so you're not spending time in multiple appointments during the week, you might look for a therapist that has experience working with people with ADHD that can use some of the coaching approach in addition to therapy as well. But then the focus of therapy kind of outside coaching is more looking on what's going on inside. What internal barriers are there to implementing some of these new strategies that we're identifying in coaching? Is there some sort of still some resistance to that? Is there some difficulty with, even though wondering I've had ADHD, maybe it is hard to accept? So there might be something a little bit more internally going on as to why they're not working. What personality dynamics, what aspects of our important relationships might be keeping us a little bit stuck. So we can work on that. Therapy can also help with self-esteem. I know something as a practitioner that I hear a lot when I get people who are newly diagnosed with ADHD coming in to start therapy with me, especially some of them that, again, if you've been to my webinars before, I hate this term, that are a little bit farther along in life in that more older adult, middle-aged category. A lot of times what I hear is, I can't believe it's taken this long to get an answer, and I've lived half my life, with it just being so difficult, and things have been hard and no one understood me. As a kid, my parents yelled at me when I didn't get stuff done. They told me I was lazy. Teachers told me that I was lazy, or they told me I was a bad kid because I kept interrupting, or would get out of my seat all the time, where I was sent to the principal for harsh punishment if I grew up in certain states as a child. And these are people that should have been looking out for me. They should have seen something was off or something was wrong. But because ADHD wasn't as on the radar back then, people assumed it was a moral issue. And that can really impact self-esteem, even into adulthood, once those people are no longer part of your life. And therapy can really help to make sense of that, find some acceptance, understanding, yeah, this was awful. It did happen. It is part of your life story. And now we can change things and really write the story that you want, for the rest of your life from this point on. It can really help to resolve maybe some of those childhood issues and build that motivation to keep making improvements. A therapist is another accountability partner if you're also seeing a separate coach. So it's just more help in staying focused, staying motivated. Therapy can also deal with some of the co-occurring conditions. Again, if there is a depression, if there's anxiety, in addition to the ADHD, if there's obsessive compulsive disorder, therapy can certainly address that as well, kind of with the understanding that ADHD can present some complications in the treatment. And these things may have impacted ADHD as well. Kind of untangle some of that and really provide good treatment for all of the conditions that are impacting attention and self-regulation, and really providing help in changing a lot of those patterns that we may have been locked into earlier when attention was worse, when we weren't able to really control our impulses so well. And we can change some of those patterns, figure out what's important to us, clarify our values, find ways to better align with them and really feel like we're aligning with them and we're being the person that we really want to be. And then just lastly, we all know change is difficult. And so even if it's a good change is difficult. There's a lot of checklists out there of stressful events and how stressful they are. And it's actually some of the good events that can be the most stressful. It's things like getting a new job, a wedding, having a child, things like that can be the most stressful. And even without ADHD, managing that can be difficult. So with ADHD, obviously it's more difficult. So having therapy to just help learn how to manage that stress, adjust to the change, having a neutral party to listen if you want to vent about things and get stuff off your chest, and then they can give you some feedback on that. That's a little bit more objective than someone who may know you a little bit better, might have a vested interest in you kind of behaving a certain way or doing certain strategies. The therapist can be a bit more neutral. So I think that can be very helpful as well. So then the next slide. All right, biofeedback. This is usually something that is done in therapy with a therapist. The goal is to learn it, but then it's stuff you can practice kind of outside of therapy. So as I explain this, if this sounds like something you would be interested in, then you might want to look for a therapist that provides this type of therapy as well. So biofeedback is basically the act of putting some sort of measuring device on the body, engaging in an activity, and kind of measuring that output. So as an example, a lot of us will carry our stress around in our shoulders and in our neck. And so we can put like EEG electrodes or EKG electrodes on our neck or on our shoulders, and on a computer screen, it will measure the level of tension. So we can see, if the tension is low or relaxed, or if the tension is really high, it means we're really kind of hunching our muscles a lot. And then we can listen to a relaxation exercise, do some guided visualization, some guided imagery, deep breathing, and we should see the muscle tension going down on the screen as our muscles relax. And so you get that immediate feedback on how your body is responding, which is where the name comes from, biofeedback. Another type is you put a thermometer on your finger and you do some breathing and visualization of being in front of a campfire, being at a beach and feeling the sun on your hands, and you see your hand temperature going up as you're doing that visualization of your hands warming up. Or the other big one that I like to use is called heart rate variability. I put a clip on someone's ear, and then on the computer screen, it will show their heart rate kind of going up and down. And when we're anxious or kind of keyed up, usually not paying attention to a lot of things, the heart rate is really jagged. It'll like shoot up, kind of go down a little bit, go up some more, and then really plummet. And it's not even. And that is just hard on the body. It's hard on the heart. We're not getting good blood flow throughout the body. And so when we breathe and relax, the heart rate becomes much more wave-like and much more rhythmic. And so again, we'll do some breathing exercises and see how the heart rate changes. And so biofeedback is really a good way to increase the awareness of your mind and your body. And you're training your entire body to relax. And so then we'll practice that, kind of get the readout, and then you go home during the week, spend 20 to 30 minutes every day doing whatever that breathing exercise or guided imagery or whatever it was. You do that and then go back the next week and get hooked up again, go through it, and you kind of see, what has changed. Are you getting more relaxed? Can you relax more quickly? Get your hand temperature up higher. We want to see improvement in that because it means your body is able to relax more quickly and more efficiently, which will help just keep us focused. We focus more when we're relaxed. We can stay with things longer when we're relaxed. We're not going to be as impulsive or hyper. So it really is a good way just to train our bodies into a better state of relaxation, as well as it kind of trains us to pay attention to how we feel. So it's about paying attention to what we pay attention to. And if we can do that, that's going to give us space to make new decisions. So it really is good for anger management, a lot of that impulsivity that can come with ADHD. You learn how to just take a second, recognize what's going on, and then you can thoughtfully make a decision instead of engaging in that impulsive behavior. And so it can really result in some behavior change as well. And then some of you may also have heard of the term neurofeedback as well, that I know gets advertised a lot as a treatment for ADHD specifically. But neurofeedback really is just biofeedback for brain waves. It involves putting the EEG electrodes around your head. A lot of times there's a special cap people can use to put it on. And then you look at your brain waves, and then you try to do different activities to try to get some brain waves to be less active, some to be more. With kids, instead of seeing the actual waves, they'll do something like, they'll show a short movie, and when the brain waves are in the pattern we want, it's brighter. And then when the brain waves kind of get out of the pattern we want, the screen starts to fade, towards black. And so they can control how bright it is. Or there's other ones where it's kind of like a scrolling screen and the scene will change and the rate of the scrolling will change as you get kind of more in the pattern of what we want, or slower if you get away from that pattern. So that can be very interesting too. The evidence of that as being effective for ADHD specifically is somewhat mixed. We know there is an effectiveness for it, but it's not necessarily, neurofeedback is not necessarily any more effective than any of the other types of biofeedback. So the key really is to kind of find a type of biofeedback and just do it, whether it's the muscle tension, the heart rate variability, hand temperature, or neurofeedback. In some settings, you might be able to do a combination of them. The equipment can be a little bit big, so it just depends on how big someone's office is, can kind of impact what they choose to offer as well. I know at the hospital I work at, we have the muscle tension and the heart rate and the temperature. My private practice office is much smaller, so I just do the heart rate variability and the temperature because that's what I can fit, but I find results are just as good. It's the practice of getting into intentionally relaxing and paying attention to what you pay attention to that's much more helpful than any specific type of biofeedback. So again, you can do this with a therapist. There are some home models for different biofeedback types. If you just want to Google like biofeedback at home, you can get some of the equipment yourself, and there's training on how to do it. I do have a lot of my clients will start it with me, and then they'll want to get their own to practice it well. So that's out there too. But I would recommend for the best effect, at least kind of meet with a therapist a couple of times to get started with it, give it a try before doing it on your own at home, just so you can kind of get that full information. So, all right, the next slide, please. Then, as I mentioned, there's a lot of apps out there that kind of market themselves as like cognitive improvement apps. So I don't want to give any free advertising, so I'm not going to name any specific names, but I'm sure you've all seen the commercials for them that focus on like, you play these games, kind of do these tasks. We can create like a whole plan for you on what to focus on and improving your cognition. And you do that regularly, and over time you will likely see an improvement in your cognitive functioning in terms of either remembering things, paying attention longer, kind of being able to plan more, kind of inhibit some of your behavioral impulses. So those are out there. Usually there's a cost to them. They're usually subscription based, so you kind of pay a fee to get started, get that initial assessment, and then they'll tell you what they recommend. And then usually there's like a monthly fee or something to kind of access them. Or you might pay like a one-time fee and kind of get like a download of what they have, and then upgrades might cost more later. So they're definitely for profit as well. There's some research out there that show that they can be helpful. The limitation that we're kind of seeing is that they're helpful in building the skill that is required to do that specific task, and you can do that task better, but the skills don't really generalize. So for example, it may be like a memory game where you have a bunch of tiles, you pick two and you try to match them, and then you have to remember what tiles are where so you can match. People get better at that over time because they start getting better at remembering what's where, but then that may not necessarily help memory for other types of things. Like if someone tells you, oh, I've got this appointment, you have to go pick up the kids after school, you're not necessarily going to be more likely to remember to go pick the kids up after school, but you might remember where you put stuff or where stuff is a little bit better. So the generalizability of those can leave a lot to be desired. But there is some evidence showing that they will help kind of at least build the skill for that specific task. I suggest there's a lot of free analogs to those that people can do without necessarily having to pay. So if there's like a subscription one, maybe you want to pay for a month or two and kind of see what the tasks are that are involved, and then you can see if you can find like free alternatives to those on your own and cancel the subscription. Sudoku is a good one I recommend a lot. Because it really involves working memory, paying attention. It's a lot of the things that are impacted. There's some impulse control with that as well. When you think you've got the right option, you kind of want to double check before you hit the number. And definitely you want an electronic one of that because you get that feedback right away and if you made the right selection or not. If you're just doing a paper one, you could totally mess it up and think you got it right. Which sometimes it feels good to think that you're right, but you're not necessarily getting that skill of getting that feedback to know that you're doing it correctly. There's a lot of memory games out there for free. You can get sustained attention games, which are kind of like doing like Candy Crush would be like a sustained attention game or something like that, where you're just doing kind of a repetitive task over and over and over and over again, like, tapping or something like tapping on the red balloons that come down, but not tapping on other balloons as they're kind of coming down the screen. Puzzle games like Tetris or the free equivalents of that, Bubble Breaker type games, things like that. The key is with those, you want to play them until you get bored and then keep playing them for about another 10 to 20 minutes after that. Because it's when we get bored is when our mind starts to wander, we lose that attention, and attention is what we want to fix. So you got to play until you're bored. And then that is when the therapeutic effect will start kicking in as you keep doing that while you are bored and trying to get better at it. So it does take a little bit of willpower to stick with it, but those can definitely be helpful as well. So then the next slide, please. And then just kind of relaxation in general. So I talked about biofeedback a few minutes ago. Biofeedback is basically relaxation and seeing that it has an impact on your body. We can definitely work on relaxing without the whole biofeedback get up. And so we want to learn how to take some time out of our day to just sit and relax. And maybe do like a mindfulness type of exercise, do some meditation. It really just helps us to slow down a little bit, get some of our focus back. and not get worn out so quickly, and just kind of help us to recenter a little bit. So again, we can do that just by sitting, maybe having a cup of coffee or something, maybe just talking with a friend on the phone for 5-10 minutes, a friend that doesn't bring the drama, that, will be supportive, that we can just have a nice, calm, fun conversation, things like that. When the goal of it was learn how to relax and increase that awareness of ourself and the environment around us. Mindfulness kind of takes that a step further with, again, learning to pay attention to what we're paying attention to. So that can be something like, for the next 5 minutes, I'm just going to kind of sit here. I'm going to kind of look for things around that are blue, or I will look for things for red, or, pick your favorite color. Or if you're going shopping and feeling a little bit overstimulated, as you're going down the aisles, you can just say, I'm just going to walk down the aisle and I'm just going to look for things, that are green, and just see what I pay attention to kind of on my way down the aisle. And then that can really kind of help to get us centered, get us connected with the environment, and really tone down that feeling of being overstimulated by it. We can do mindfulness just like in our daily lives of just something else is like, just talk yourself through a task. If you're washing dishes, just give yourself a running monologue and just say, I'm picking up the dish, I'm turning on the water, I'm holding the dish under the water, I'm scrubbing the dish, I'm pouring soap. And if you just kind of talk yourself through that, you just realize you're paying attention to what you're doing instead of zoning out. And it really creates more of that intention, more of that awareness, and again, gives us more space for making some different choices. So there's a ton of different kinds of meditations, mindfulness activities, or relaxation activities. If you just Google mindfulness, Google meditation, or Google relaxation exercises, you're going to get tons and tons and tons of results. So you can practice them at home. Sometimes therapists can do them as well, especially if I have a client that's talking about something that's happened during the week that is getting them very emotionally activated again. I'll go through kind of a mindfulness exercise with them to help kind of get them recentered, refocused, and be able to get a little bit more kind of objective and back into their thinking brain, again, to figure out what they want to do about this instead of being run by emotions, which, while emotions have their purpose, they're not always the most rational. And so we kind of want to recognize that as well. And so mindfulness can really help with that. So there's tons of resources online. Again, if you have a therapist that you trust, they can certainly kind of give you some recommendations as well for that. So then the next slide, please. So then paying attention to our health overall can really help improve our attention, even without ADHD. There's a lot of medical conditions out there that can take up our mental bandwidth, especially pain conditions. They take up a lot of our mental bandwidth when the pain is bad, like with migraines, sickle cell anemia, MS, things like that, fibromyalgia, where we're just feeling a lot of pain. It's harder to pay attention to what's going on around us. So we may have someone talking to us and we're not really hearing because the migraine is really bad and we're thinking about trying to go home, trying to like not throw up walking down the hallway because the pain is so bad, things like that. And then someone 2 days later be like, hey, remember when I told you about, X, Y, or Z? And you're like, well, no, I don't. And it's because, we just didn't hear them because of the pain. And so if we can get the pain under control, that can free up some mental bandwidth. And then that goes back to, there's medical treatments for that. There's a lot of psychological treatments that can help with pain and increasing the mental bandwidth. Biofeedback can be helpful for pain, especially for headaches. The muscle tension and hand warming one are really great at helping to reduce headache severity. And so if we can treat that, that will just kind of give us more of that ability to attend to the world around us instead of being a little bit more in our own heads, focused on something else. There's also health conditions that can exacerbate depression and anxiety, which then eat up mental bandwidth. So like thyroid problems, like an overactive thyroid can lead to like anxiety type of symptoms. Underactive thyroid can be more depressive symptoms. Heart conditions, can lead to more feelings of depression. That's one of the things I worked in cardiac rehab. And one of the things a lot of people say is I never really knew what depression was until I had this heart attack. And there really seems to be a strong correlation between like a heart attack and just having like really bad depression for about 4 to 6 weeks kind of after that. That kind of comes with having to be almost completely inactive, kind of the scare that comes with that thought about mortality. And it's just the heart itself, by being, more impaired, not getting blood effectively, can really cause a lot of those like vegetative depressive symptoms. Diabetes can really mess with mood when blood sugar is out of control as well. So that's taking up a lot of our mental bandwidth and can lead again to like things that look like impulsivity and hyperactivity. So it is good, if you're getting ADHD checked out, maybe get a full physical as well, kind of rule out any physical causes that can be going on that might, if not be fully causing it, at least contributing to it. So we want to get those taken care of, follow the treatment plan with the doctor, try to eat well, take the medications, and then exercise can be helpful as well. Regular exercise, again, it gives us structure, it can release endorphins, which will help with mood. We do know doing a brisk cardio exercise for about 20 minutes, 4 times a week is one of the best treatments for depression, for improving mood. 3 times a week will maintain mood, 4 times a week will improve mood. And it's just 20 minutes of a brisk cardio. You don't have to go to the gym and run all out on the treadmill or anything. You can just walk around the block for 20 minutes. The goal is just keep moving at a little bit of a faster pace than your normal walking. Get the heart rate up a little bit and make it continuous. If you're stopping to wait for a light to change, then you're kind of setting yourself back to the beginning again. So maybe kind of going around the block, walk around the mall, go to a track at like the high school or a park where you can walk around completely uninterrupted for 20 minutes. And so it will help with mood. And again, building in that sense of structure, feeling like you're being proactive in your life will help. And it gives you more of a sense of control over your life, which ADHD can really rob, as well as pain can rob that, other health conditions can rob that. The more we feel in control of our lives, the better decisions we're going to make, the better we feel, the better that we can really just kind of attend to our lives. And I do see that pop-up question. I will answer that now. Is no, it does, as much as possible, needs to be 20 continuous minutes, because that just gets the heart going for that long. And that really is what improves health. If we do a 10-minute and then stop, we're not getting the heart elevated for as long as we need to really promote improved cardiac health, get the blood going, get kind of that continuous wave of endorphins kind of going through our brain. So it does. So unfortunately, it does have to be the full 20 minutes at a time. So that is and of course, in our busy lives, that is the challenge as well with doing that. And again, that's where therapy might help build some of that motivation, help with more effective scheduling to really build the time in to make that happen and have the accountability. So, all right, next slide, please. I know we're getting to the end here. So sleep is important as well. Sleep deprivation can cause cognitive difficulties that then can look like ADHD or can exacerbate ADHD. So we really want to try to sleep as well as we can. And again, in our busy lives, that's a lot easier said than done. So again, some of the other strategies like coaching and therapy might be able to help rearrange our schedules and give us the confidence, help us have the self-esteem to prioritize ourselves, to set these boundaries, to get the sleep that we need per night. So most adults need about 7.5 to 9 hours a night. I know I had said last week, even when we get into true old age, like 80s and higher, there's this myth that people that age only need like a few hours of sleep a night, and that's not true. Even at that age, we still need 7 to 7.5 hours. If we're constantly getting 6 hours of sleep, we're going to get into that sleep deprivation. And 6 hours is interesting because it takes about 2 weeks of constantly getting 6 hours. And we really, at that point, we really start getting consistently sleep deprived. But we're not aware that we are sleep deprived at 6 hours. We'll feel somewhat rested. We may be a little bit tired. And we're not paying attention. Part of that sleep deprivation at that amount is we're not paying attention to what we do. We don't realize we're making mistakes or that we're being careless. So there's some of that lack of awareness there. When we get under 6 hours, like if we're getting 3 or 4 hours a night, we know we're sleep deprived. We can see it, we can feel it, we know things aren't going well. But at 6 hours, we're still doing those things. We're just not as aware of it, which makes it more frustrating for the people around us. And again, that can look like ADHD because we got people annoyed at us and we don't really know why. We think it's just the way that we are. So we do want to take a look at sleep as well. And then the other thing is with that therapy, in addition to building the sleep habits, There's a specific type of therapy called Cbti, which stands for cognitive behavioral therapy for insomnia, which focuses on retraining our brain and our body to get better sleep. So if we're dealing with insomnia, if we're getting that 6 hours or less of sleep, or if we sleep for a couple of hours and then wake up for 5 hours before we go back to sleep, Cbti can really fix that and create a lot of improvement as well. So again, that's a bit more of a plug for therapy as part of sleep. So that would be something to look into if you're dealing with insomnia. You don't want more medications. Cbti is great and it's pretty fast. It's about 6 to 8 weeks to really get a significant amount of improvement. It can be a little painful to go through because you are going to increase your sleep deprivation a little bit. So you do want to do it at a time when you don't have a lot of external responsibilities. Trying to do it at the holidays is not going to be the best thing. If you got a promotion coming up, that's not going to be the best time to try it. But maybe in the summer, if you can take a bit of a vacation for the first week or two, when it's going to be the worst, you can do that, or wait till the kids go back to school. So when you don't have to be around them in a ton of all the time, maybe you can do that then. And there's a few conditions where it's contraindicated for, but a good therapist can do the assessment and figure out if that will be helpful. Then there's another condition called just offset circadian rhythm. And this is where you don't feel sleepy or tired until like 3 or 4 in the morning, and then you sleep to like noon or 1 and kind of get up. Or you get tired at like 6 or 7, go to bed, and then you wake up at like 4 in the morning and can't go back to sleep. So that's known as offset circadian rhythm. Interestingly, it was a bit evolutionarily effective because the people that didn't fall asleep until like 4 in the morning were kind of the overnight watchmen. As everyone else was sleeping, they made sure like the saber-toothed tigers didn't get near your encampment or something. And then the people that wake up early would then relieve them and do kind of the rest of the night watch while they then got their sleep. Obviously, we don't need that so much anymore, but that still is kind of baked into our genetic code a little bit. So people that suffer from this, life can be very frustrating because again, you may get the messages, you're lazy. Why are you staying up until 4 in the morning? You should go to bed earlier. Then you can get up and get to work on time. People that fall asleep early, again, might feel like they don't have much of a social life. They can't go to the theater or do stuff after dinner. They're always getting the early bird special, even at 30 years old. It is harder to treat. That is definitely, it needs medical treatment. There's not a lot that psychology can do for that other than managing the frustration and finding help with kind of structuring your life around that sleep schedule. But again, it can look like ADHD because of that offset sleep. So again, you might get some of that moral judgment with it. If you're stuck in a job where you have to be there at 8 in the morning and you're not falling asleep until 4 in the morning, you're going to have that sleep deprivation. So it can look like ADHD as well as other mood disorders. A lot of times people will come in saying, I've got insomnia. And so we'll do a sleep record. And it really turns out it's more an offset circadian rhythm because once you fall asleep at 4 in the morning, you're sleeping just fine until you wake up at noon. It's not interrupted. You're not waking up early, which is more of the traditional insomnia, and you're getting enough sleep when you're able to. And so we usually see that people will get like 3 hours of sleep during the week and then sleep for 12 hours on their preferred schedule Friday and Saturday night. And then Sunday is rough and it's rough through the week and you get to the weekend and you're back on your own schedule. So that's something you'd have to talk with the doctor about. And it's more about finding ways to arrange your life around the sleep schedule rather than trying to get your sleep schedule to conform to life. So I know I'm talking way more than I wanted to here. I want to leave some time for questions, but I think I just have one more, real fast, substance use. And again, there's absolutely no judgment here as I'm talking about this, but we do know there's a lot of substances that can impact our attention. And so I'll start with smoking or vaping because that's becoming more common as well. Vaping is not necessarily a healthier alternative to smoking for many reasons. But the big issue in terms of ADHD and attention is that nicotine withdrawal will diminish your mental bandwidth. So as anyone who's tried to quit smoking knows, you can get a couple of hours and then your brain is like, where's that nicotine? Where's the cigarette? I want my nicotine. And you're not paying attention to anything else. And your own mood is kind of like crashing into the basement as well. People are probably telling you, stop being so crabby. And so it really impacts attention. And so even if you're not trying to quit smoking, once you kind of get through that hit of nicotine and go into withdrawal, your brain is just going to say, hey, go smoke, go smoke, go smoke. And it's not going to stop until you go to smoke. And so that's taking up attention. And then usually in this day and age, you have to go somewhere to smoke. So you got to leave the building, find a place to smoke, you light up, have the cigarette, get back in, get your jacket off, and then you're like, all right, what was I doing? Where was my pen? Where was the sheet of paper I was working on? What's this note in my handwriting I can't read? And then you're already halfway through that nicotine wearing off by the time you finally get back on track. And then 10, 15 minutes later, your brain's like, hey, go smoke, go smoke, go smoke. So if we can quit smoking or really cut down on that, that can give us more of the mental bandwidth back. Alcohol as well can impact our sleep, which can then lead to more sleep deprivation, as well as obviously while we're drinking, our attention is going to be somewhat impaired. So for men, the recommendation is no more than 3 standard drinks in a 24-hour period and no more than 15 in a 7-day period. And so a standard drink is like 1 beer, 1 glass of wine, like 1 shot of like 80 proof hard liquor. And then for women, it's 2 drinks in a 24-hour period and no more than 8 in a 7-day period. When we go beyond that, it's considered binge drinking, which really increases the risk of having like accidents, like, falling down the stairs or something, being the victim of a crime, having more health conditions when that happens. So, all right, next slide. And I believe this should be about it. Marijuana can really impact motivation, concentration, and memory. So, if there are things going on that you need to pay attention to, it's probably best not to use it in whatever form. Smoking actually will kind of go through you. So you have the impairment, but then it wears off. Edibles can kind of live in you for like 8 hours or more, and there's a lot less control over that. So they're really not a very effective way to get high if you're living in a state where that's legal and that's what you want to do. So I really try to recommend, if you're dealing with ADHD, attention is already difficult, it likely is going to be best to, as much as you can, stay away from marijuana, because it's just going to take a bad situation and make it worse in terms of paying attention. There's also a lot of marijuana derivatives out there. I know there's the Delta 8 THC. There's like full spectrum THC. Those are just as bad. There's even less kind of oversight of those. They're often made in very dangerous ways. They can have a lot of contaminants in them. There's no oversight or regulation of them. And they're still going to impair your motivation, concentration, and memory as well. So it really isn't a great thing to do, even recreationally as well. Medical marijuana is a thing. We do know that it's helpful. There are increasing alternatives out there in terms of like non-impairing medications. So if you're using medicinal marijuana, it might be helpful to talk with your physician about what other alternatives are out there. And if you absolutely have to use medical marijuana, try to pick a strain that's got the least amount of THC as possible, just so it's as less impairing as possible. So, all right, so I think this is my cue to wrap up. Yeah, we just want to watch out for other recreational substances. They're all impairing. Prescription medications can be misused. Caffeine, because that caffeine will impact sleep and then lead to all sorts of the sleep deprivation problems. I think you can have up to like 2 cups of coffee in the morning before 10 o'clock is generally considered okay. As long as you don't have like any cardiac conditions or anything, and your doctor's cleared that. But kind of beyond that, if you're chugging coffee all day, it's going to be almost the same as smoking, where you're just kind of chasing that caffeine, avoiding the withdrawal of caffeine as well throughout the day. And again, that does get you hyped up. That can increase the impulsivity, some of that stuff as well, if you're drinking too much caffeine throughout the day. So kind of everything in moderation. Use prescription medications exactly as prescribed. Use only the ones that are prescribed to you, and talk with a professional if that's difficult. So, all right, I have talked way too long here. So Keith, what questions do we have?
All right, and I'm sorry, I did not mean to scuttle that last slide, user error. So I'll jump right in. So we had a question from Arlene. She said, are there any referrals you would make to who can help with the ADHD coaching?
I believe we may be able to offer that at ADHD Online to some extent. So calling customer service when you get the your assessment back can be a good first step in seeing what services are available to you.
Yeah.
Otherwise, probably just Google like ADHD coach in like my city. I know there's some professional associations as well with ADHD and executive functioning coaches. So that would be the best place to start. And then you would just kind of want to vet them like you would a therapist, like how long have they been working? What experience do they have? Do they specialize either with kids or adults? Things like that, and again, kind of see who you're comfortable with. Give it a few sessions, and if it seems like it's not a good fit, don't be afraid to move on and try someone else.
Yeah. All right. Just a comment that came in via the chat. Megan said, I ended up using multitasking to procrastinate, but I didn't realize it.
Yep.
Do you hear that often?
Oh yeah, we can feel so productive when we are multitasking. It's a great way to think we're getting stuff done. Usually, if you know the 80-20 rule, we're kind of multitasking on that 20% stuff. So it might be a little bit easier stuff. It's not the big stuff that we really should be focusing on to maximize our time. But it is a great way to try to pretend that we're being productive when really we're not. It just clears stuff off the to-do list without necessarily making a huge dent in the important stuff.
That makes a lot of sense. All right, we had a question in the Q&A from Katrina. She said, do you have any recommendations for apps for time blocking, scheduling, or to-do list? I find I have a hard time estimating how long things take, and I constantly overfill my day. Then I just feel like I failed at the end of the day.
Absolutely. That is so common. I think, and especially with ADHD, like we want to think I can get all this stuff done. And people with ADHD can be kind of infamous in your friend group for kind of over promising when you're going to be somewhere and then not being there on time. So kind of my rule of thumb is when you're first starting to get a handle on this, whatever estimate you have, double it and see how that fits into your schedule and just work on that. And that will really help you kind of figure out as well, like what's really important that I need to focus on, what can I kind of let go until tomorrow or over the weekend when I'll have more time to gear towards that. So that's probably the best step. And then again, I'm all about free. So I'm just like, if you have a smartphone, learn how to use the calendar function. There's a lot of free kind of sticky note apps out there that you can use to make to-do lists, either kind of writing them down. Some of them will even do it as a checklist, and then you check it and it will cross it out for you so you can get the satisfaction of that. And then just put up like, actual Post-it notes kind of around the home, be like, remember to look at your to-do list right now, so that when you see it, you remember to pull it out and see, or say, remember, look at your calendar right now. So you can kind of get in that habit of checking the calendar, every 45 minutes or an hour to see what's coming up next that you haven't forgotten, and make sure you don't forget about it.
Yeah, I find the voice reminders are extremely helpful to me.
Yeah. And then Siri, Alexa, Google are all super helpful as well. Because if you have something really important at the start of the day, just ask them to remind you, like, 20 minutes in advance, and then 10 minutes in advance, and then 5 minutes in advance. So you'll get that reminder.
Yeah. Great. All right. Well, Carl had a question. This is medication related, but I think, you may have some thoughts on it. So he said, I recently began medication treatment for ADHD, which cured my lifelong insomnia. I meticulously adhere to a sleep hygiene program. I normally lucid dream every night, but haven't become lucid since I began treatment. Does medication normally influence dreaming?
That I do not know.
Yeah.
So yeah, I would talk with the prescriber about that. Hopefully it's not too bothersome not to have that. I know some people do kind of like dreaming. It can get like creative inspiration from it. So if that is a concern, just talk with the prescriber about that.
Great. All right. So next question. Well, Katrina had another question. She said, the idea of embracing ADHD is growing online. What does this mean to you? And is there a way to make the most of your strength as an ADHDer? I love this question.
Yes. Because to me, it really means, love yourself for who you are. Really just kind of recognize this is me. I've got this condition. It is a condition. It's not necessarily intrinsic to my value as a person. It's not who I am. This is something I have, something I deal with. But it is still a part of me just as much as like my eye color, my hair color, lack of hair, whatever the case may be, my height, things like that. And so it's really about learn how to live your best life, understanding you have this condition that can impact your attention, might impact your impulsivity, hyperactivity. Find people that can embrace that can understand it, that will help you with it. Do what you can to manage it and kind of understand and enjoy the part of it that makes you special.
Yeah. Well. I mean, I would tell Katrina, as someone recently diagnosed, I'm in the embracing ADHD stage because I am realizing where it plays to my strengths, but also then realizing some of the areas where it gives me a new context for understanding that I didn't have before. And that is huge as a person.
Yeah, absolutely. And I think people with ADHD know, there is the issue of timeliness and such, but people with ADHD can be like great friends because you're very talkative.
Right.
You kind of want to connect with other people. A lot of times you can be kind of the life of the party. The key is kind of learning how to rein that in a little bit to be more present in those conversations. But I think there's definitely a lot of strengths to be had there.
Yeah. Great. Let's see. We had another question in the chat. Mary said, how do you feel about melatonin?
The evidence is kind of mixed on that. It's not the silver bullet that it was thought of as for the past 10, 20 years or so. More controlled studies are showing a little bit more of a mixed result with that. Our bodies kind of naturally release melatonin. Adding more doesn't necessarily do a lot more. But again, that would be something more. Talk with the physician, find a sleep doctor that really knows that, and have that conversation with them and see what they would recommend on it.
Yeah. Let's see. There's another question from Megan. She asked, is ADHD and CRD, are those common to have together?
The circadian rhythm disorder.
Yeah.
I don't know that they're necessarily linked together in any sort of way. And again, like I always say, there's no karmic law that we're only limited to one condition in a lifetime. So it certainly would be possible to have both. My assumption is if you have the circadian rhythm disorder and you are trying to live life in a 9-to-5 world, you're going to be sleep deprived on some end of that, which can definitely look like ADHD. And then if you do have ADHD on top of it, it's going to make that a lot worse. But I don't know of any research that necessarily shows kind of a strong comorbidity between the two, like we do see like with bipolar disorder and ADHD.
Yeah. She said alcohol masks so much. And then she just said, what about at night for sleep?
Alcohol for sleep, generally not really recommended. It's great at helping us fall asleep right away. Oh, or marijuana. Okay. Alcohol will help us fall asleep right away, but then it interferes with the quality of the sleep. And we tend not to get into those deeper stages of sleep that we really need for the mental restoration. So you, again, may be waking up a little bit sleep deprived if you're relying on alcohol for sleep. Marijuana for sleep, again, the studies aren't necessarily there for that. Most of what we know is anecdotal. If you're smoking just a little bit and kind of going right to sleep, there shouldn't be too much of an impact. By the next morning, it should be worn off. I would recommend, and again, I'm not a medical professional at all, but just anecdotally, CBD might be something better to try because that doesn't have the psychoactive properties that THC does. THC can be somewhat more activating. It's usually more the CBD part. So if you're using a higher CBD strain, is tend to be what puts people to sleep. But again, talk with a physician about that. One that would listen, one that will consider marijuana. Because again, I try to be judgment-free with that. There are some studies coming out on its usefulness. So try to find a doctor that would listen and be willing to have that conversation on that. I will say too, there is a phenomenon where if you use marijuana consistently over time, it can end up having a paradoxical effect of increasing anxiety. So that's not necessarily something I would want to use as a long-term solution for sleep either, because then you might find yourself waking up in the morning feeling more anxious than throughout the day, and then kind of creating potential maybe for more of a substance use type of cycle to try to chase that anxiety. So I really would just say talk with the doctor if the sleep is that bad,
Yeah.
you feel like you need something to help. And maybe Cbti might actually help get you to sleep better than without needing to rely on a substance, and that will be much longer lasting.
Okay. Well, I know we're at time, but we've got one question that I'd love to
Okay,
finish on. 'Cause
I will
feel
answer
like
it. Yes.
I feel like this is a really good one. So Arlene in the chat said, as a 60-year-old, how do you suggest telling people who've been affected by my ADD? How
I
do
would
you
just,
bring it up?
yeah. I mean, I would just kind of bring it up, matter of factly, because again, like I said earlier, this is, it's part of who you are. So this is a condition that you've had. And so if you find people are complaining or making comments about it, you can just say, no, well, I'm glad you're bringing this up. I've wanted to talk with you about this. I was just diagnosed with ADHD, fairly recently, and it really has explained a lot of things I've been dealing with and frustrated with my entire life. And then you can kind of go into, what the impact has been on you, kind of how it may have played out, maybe talk a little bit about why it took until now to get diagnosed again. ADHD may not have been on anyone's radar, back in your school days or even early adulthood. And then life kind of happens and it's harder to find the time to follow up on. And now finally you've kind of had the time and you're ready, to have a great rest of your life. Which will hopefully be long and fruitful. And no, absolutely not being a victim at all. Because again, it's part of who you are. It's like finding out you've had diabetes.
Yeah.
Or, finding out that you've had like hypothyroid. It's a condition that you had. You tried to do your best with it. It wasn't treated very well, but you are taking control now. You got the diagnosis, you are in treatment, and you know that it really is going to have a big impact.
Yeah.
Because especially it's like focusing on, I'm all about the now. The past is the past. It happened. We can make sense of it. We can understand it. But the important part is what can we take away to have a better now?
Yeah. I think this, I know this is true for myself, but I often find I get more wound up about what I expect will happen than what actually happens. And people are usually much more receptive to that understanding, especially when you're presenting it to them and like, look, this is new to me. And I'm telling you this in an effort to help our relationship. It's very hard to take that negatively from my experience or have that go bad.
Absolutely. So thank you for that.
Yeah. So yeah, great question. So Dr. Harms, this has been an outstanding hour. I learned a lot. I'm very glad that we were able to share this with everyone that joined us. We will have this up on our website within about a week. And so you can play it back later, share it with others. We encourage you to do that. Thank you so much, Dr. Harms. We really appreciate it. Thanks to everyone who asked questions or participated today, and apologize if we couldn't get to your question before we ended, but we will see you soon again. And thanks again.
Yep. Thank you.
Thanks. Bye.